Hi, I would like to answer this question that a lot of my clients always ask and they're not sure about the differences between a psychiatrist, psychologist, and other forms of therapist. Well, I can start with definitions and the criterias and scope of practice for each category. Psychiatrists are physicians that they go to medical school, they finish medical school and they go to residency and finish their residency in psychiatry. They usually prescribe medication and also at times could provide therapy, but mostly they do medication management. We also have psychologists that they either have PhD or PsyD or PsyD as we call it. PhD stands for Doctorate in Philosophy and PsyD stands for Doctorate in Psychology. Either way, a psychologist, usually a clinical psychologist here I'm referring to, is someone who got his doctorate degree in psychology and who is trained in providing therapy as well as assessment, which could be psychological testing in order to diagnose people with ADHD, depression, personality disorder, so on and so forth. Then we have a group of people as marriage family therapists or LMFTs. These individuals and experts get their master's degree, usually in counseling psychology, and they specialize in working with individuals, couples, and children. But their scope of practice is less clinical and more into counseling and helping individuals to get along and work better together as a system. So in a sense, a lot of times they might come across as advice givers. Psychologists, on the other hand, usually delve deeper and work with the individual and at times with the inner dynamics or like unconscious dynamics. Well, we also have other groups of people and experts like social workers, LCSWs, licensed clinical social worker, that they also have their master's degree and they practice with that license and help individuals. Again, they could do individual, couples, or help with other issues in the social setting like homelessness and domestic violence.